Welcome back to Empowered. I'm Elizabeth Namofsky. Today's topic, is it dental? And I'm joined by Dr. Willa Chu. She's a dentist and owner of the Concourse Dental Center in Toronto. Dr. Chu, besides the gums, there are other tissues in our mouths. What else do dentists observe that's not dentally related?
So it's a good question. It's something I have to mention is that the cheeks and the gums and the tongue can all get ulcers. So I think a lot of us have had canker sores in the past, and they can be the tiniest things but cause a lot of pain. A lot of patients will come in and they will come in and say their tooth is hurting or their jaw is hurting, and it comes down to this very, very tiny ulcer called a canker sore. Other ulcers that appear in the mouth can be related to stress. You can have tiny little white ulcers that just kind of clump in a little area, and they just cause a lot of pain. And it's very self-limiting, thankfully. And the rule of thumb is if something goes away in 2 weeks, then it's fine. However, if it lingers, then you need to have it looked at with a dentist. So a lot of times it's, if in doubt, check it out. Other ulcers that can appear in the back on the lower part of your underneath your tongue, or on the inside of your cheek or along the gum line. You want to look for ulcers that are different colors with red and white all mixed in. Those tend to be more dangerous. So we do screen out for cancer. Oral cancers actually make up at least about 4% of cancers found every year now. It used to be 2%, but it now is increased. There's also lesions in the back of the mouth, what we call your pharynx. And with the advent of a lot of human papillomavirus symptoms now and conditions, we are seeing more of pharyngeal cancer due to HPV or human papillomavirus. So the increase of oral cancers makes it really important for us to check the ulcers out, because they're not always simple canker sores or simple trauma ulcers. They can be underlying diseases that your dentist can help you diagnose and send for medical attention.
This is all really important information. Sorry, please continue.
No, I was just going to say that the most important thing is the dental exam. So when we first started, we talked about, what do we look for in a dental exam? It's not just teeth. And I think patients in the public need to realize that dentists can check a lot more things for you than just your teeth and how much tartar you have. So if in doubt, get it checked.
So this next question was requested by a viewer. With the increase in patients receiving cancer treatment, what can they do to maintain their oral health?
Yeah, so one of my patients also brought up this question. I think it's really important because there are a lot of patients with cancer treatment. Cancer is not a friendly disease, and even though you don't have cancer in the mouth, you get cancer treatment, a lot of the medications will affect your mouth. A lot of the cancer hospitals, thankfully, have dental centers, and patients will get screened for any diseases of the mouth prior to the start of cancer treatment so that they can receive the care they need. A lot of cancer patients will have mouth sores. They'll get dry mouth. They get burning mouth. They get less saliva flow. So those are things that will create cavities. So if you have a cancer treatment, if you're going through cancer treatment and you have any of these symptoms, one thing you have to remember is to really protect the teeth. If you have dry mouth, use a high fluoride content toothpaste. Make sure you increase your fluid content so that you're constantly moisturizing your mouth. There's a lot of products out there for moisturizing your mouth. There's tablets you can stick on the side of your gums that slowly dissolve at nighttime to increase the salivary flow. Xylitol products are out in the marketplace. They help fight off cavities. They help stimulate saliva. They do not cause cavities. So there's products like that. You can also use a sort of softer toothbrushes, not to aggravate the tissues that are already whether dehydrated or very hypersensitive because of your treatment. But the most important thing, I think, is to see your dentist, to make sure that your dentist knows your condition so that we can help you manage your mouth as you go through your cancer treatment. So if in doubt, get it checked out. And it's Dental Health Month, so I hope you all go see your dentist as soon as possible.
Dr. Chu, thank you so much. Your words of wisdom, I know, will help a lot of people and help educate us all about our mouth. So thank you so much for being on the show today.
Thank you, Elizabeth.
You heard it from Dr. Chu. She says, if the tongue is your check engine light indicator, your teeth show the history of your life. We have to protect our teeth for our future selves. Not all things may be dentally related in the mouth. When in doubt, check it out. Dentists are here for you. Happy Dental Health Month. I'm Elizabeth Namofsky, and I'm here to empower you, make frugality fashionable. Bye for now.